All right, Clint, good to see you. I got to ask you, I have been wondering why we don't, as Americans, get the exposure to these alternative remedies and alternatives that you have to hold, that you can bring to the table. Why don't we hear about them more?
Yeah, so really, Sean, the issue is the deck is really stacked in favor of big pharma, and the American public really saw it during COVID when, as you remember, there were so many valid natural solutions that were being discussed and even being offered by medical professionals in private, that if you went to make that public, there was an intense amount of scrutiny. People lost their licenses, they were prosecuted. It was crazy. And that leads into advertising. So big pharma controls a lot of media when it comes to advertising, and natural supplement solutions are barred from really discussing what they can actually do because they're not considered a drug through the FDA system. So essentially what happens is pharma has a monopoly, because even if you have something with clinical research that you can show the American public, it's right here, here's everything that's been tested with it, you can't talk about that unless it's officially a drug through the entire system. And if you don't have the $1 billion to do that, you can't talk about it.
Which seems silly, right? I mean, I think, it's funny. When I got COVID, my doctor said to me, here are like the 5 things that you should take. Vitamin C, there's a thing called Curacin. I had a little list, and I would show it to other people as they got diagnosed as well and say, hey, here's what my doctor told me. And he was like, all natural remedies. And yet it was like a one-off kind of, like, I felt like he was being sneaky. He's like, by the way, before you go, here's what you should know. Why would it? I mean, it seems absolutely ridiculous that if you have something that can help people, that's not illegal, it doesn't hurt them. I mean, taking copious amounts of vitamin C, unless you're probably taking a ton of it, isn't going to hurt you. Like,
exactly.
What is it? So is it just big pharma? Is it the medical community? Is it the government? Is it all of them in cahoots?
Yeah, it's really, I call it the unholy alliance, unholy trinity. And you have big food, big pharma, and the FDA. And they kind of all work simultaneously for the main purpose is profit. Huge amounts of profit. And again, it starts with a lot of the food that we eat. And when you look at the 2,000 preservatives and other ingredients that are illegal in other parts of the world that we have here and we buy every day, then it moves into, you get sick, you go and get a pill from your doctor, because the doctors are highly regulated too. They have to be careful about what they say and don't say about things that aren't a drug. And of course, it's all being supervised by the FDA. So again, it's built for profit. That's the problem. Is the system, I call it perverted, because it's not there to help. It's really there to make a profit. I mean, that's how it's geared to happen.
So first of all, you mentioned the advertising aspect of this. Explain that to me for a while, because I mean, when you watch television, it's literally like this drug, that drug. And by the way, it can cause 18 different things. But they advertise all the time that talk to your doctor about this, it'll cure that and cure that. What are the advertising regulations for something that doesn't go through the FDA but doesn't harm you, if it's all natural?
Well, one quick point I want to make is we're one of the only countries in the world that actually allows pharmaceutical advertising. When you think about it, a pharmaceutical is something that should be prescribed by your doctor. You should come in with an illness and they should say, hey, based on my years of experience, we're going to prescribe you this drug, instead of it being advertised where you're walking in the door saying, hey, doc, I need this. That really shouldn't be how it works, but it is how it works here. Now, to your question about supplements, it's all about what you can say. And that's the problem is, yes, you can go on and create an advertisement for a supplement, but you really can't say what it does. You can't say that it's clinically proven to do anything. You can't actually talk about the function that would be considered a drug claim, even if you had the scientific research behind that. And that's the sad part.
So what, for example, like you go out and you get 10 Harvard studies or something like that.
Yeah.
Can you acknowledge them? Can you say Harvard looked at my drug or my cure and it says it's great?
Nope.
Can you guide people to it and say, go look at this link?
Nope, because in the world of the FDA, if you did that, you are essentially making a drug claim. So you are now taking your natural supplement and calling it a drug. Therefore, you're making unsubstantiated drug claims. Even though it is clinically proven, you haven't gone through the drug approval process with the Food and Drug Administration. So that's just this huge hurdle that companies can't get around.
Okay, and it's how expensive is that hurdle? Let's talk brass tacks here. How expensive? If you have a product and you say, and also like the other thing I'm wondering is when you keep using the word natural. So if it's a natural existing product, right? I.e., it doesn't do any harm. What is the whereas like an off-label use of a drug, right, which we're all starting to get familiar with, can hurt you, can literally hurt you. If you take an off-label natural supplement, could they potentially hurt you? Or is it, I mean, that's what I think is fascinating. As far as I know, I mean, for these things that I read about, it sounds like if it naturally exists, the odds of it doing any harm to you seem rather low or non-existent.
You're totally right. And really, for most natural solutions, natural compounds even, your body will get rid of what it doesn't need. So running the risk of any sort of overdose or using too much, because you're supporting a natural function, whereas a drug is mimicking or taking the place of a function your body does, which is why you become dependent on it, which is why you need it usually for a lifetime, because your body's so smart, it realizes that, hey, I'm taking a drug, it's doing the heavy lifting for me. I no longer have to do what this process is. And that's where people get into a lot of trouble. And we're seeing it right now with Ozempic. I mean, that's the biggest off-label use currently is that's a diabetes drug that's being off-label used as a weight loss drug. It's not even approved for that. And it's being used rapidly.
I do love the ads though, because there's always these shortages, and they're like, but when you read the ads, it goes, you may lose some weight, and it's like, what do you think? I mean, they know exactly what they're doing.
They know exactly what they're doing. Yeah, and if a natural supplement did that, the owners would probably end up in jail. I mean, it's that lopsided. It's crazy.
So how did a guy like you get into this? Like what made you look at natural supplements and what the government was doing and what the hurdles were?
Yeah. So for me, it's all based around canoladine. I told you in a previous conversation that by trade, I'm a medical scientist, but my field of study was really medical devices. I wasn't even in nutraceuticals or pharmaceuticals. That wasn't my path. And my mom got really sick at the end of 2015. She ended up having a terminal cancer diagnosis. And to a point where the only thing we could do as a family was keep her comfortable. And I'm sure a lot of people have been in that scenario where that's all you can do for your family member. And with all the treatments she was going through, because she was with chemo and radiation, the doctors prescribed her morphine. And I saw firsthand what a drug like that would do to somebody. And we lost our mom months before we actually lost her, because she was no longer with us. She was a zombie. She was really dependent on this pill. And during that time, I took my scientific focus and started to try to figure out, is there something outside of morphine that would give her relief? And I went down the rabbit hole of CBD and THC and all that kind of stuff first. And then when I dug deeper is when this bombshell exploded in my face, which was canoladine, like just what we're talking about right here, clinical documentation of a natural alkaloid that had opioid-like relief qualities without side effects, without addiction, and nobody was talking about it.
Okay, so I don't. Okay, so you find canoladine. Why? I mean, I you're a smart guy. Like, let's just okay, okay. But why? I mean, but why isn't Big Pharma going, hey, we found what Clint found?
So here's the thing: they have, but they're trying to
wait. Hold on, they knew this. And they didn't do. I mean, to me, you got to be kidding me.
Yeah, and that's that. And let's think about the time period too. This is 2016, 17. That's when we're entering the real gloomy days of our opioid epidemic. The start of it, when things got really bad with OxyContin, and we were looking for solutions, right? Well, the solution was there. They knew about it, and instead of talking about it, they filed a patent to synthesize it to turn it into a new drug in the future. So they knew what they had. They knew what canoladine is. They knew it could help. And their focus was, how do we make money from this? Even though people are literally dying on the streets with opioids, this is a way to fight that 100%. It already has, but yet they did nothing.
Okay, so why? I mean, I don't get it. Why? Like, is it because they couldn't make enough money, or they were making more with OxyContin? Like, what is it? I don't get that.
Yeah, because here's the thing about drug companies is they'll take most drugs, most pharmaceuticals originate from a natural compound, right? It starts natural, then they synthesize it, then they usually change the molecular structure, and then they patent it. And once they have patent rights, now they can protect it and make billions and billions and billions of dollars until it finally goes into generic use down the road. So to them, they're willing to let people suffer while they go through that synthesis process to then eventually make a bunch of money. So even though this is something that they could have, like I did, figure out how to extract, roll it out naturally, they're not going to do that because that's not their profit model. They'll make a lot more money from it later on down the road.
So literally people, and here's the thing that I find fascinating about what you just said. It's one thing to put that off in terms of the pain and suffering, but you alluded to this. We're going through this massive opioid addiction problem.
Yeah.
And they could help solve that, and yet they're choosing not to.
They are. And a lot of these big pharmaceutical companies also own nutraceutical companies. So they could have absolutely rolled this out quickly to the masses. I mean, the solution was there. The science is there. It's been studied now for 14 years. It's the only known compound to enhance your body's natural endorphin flow, which is how we naturally fight pain. It's there. The research is there. It's helping people right now as people are watching this. It's working on thousands and thousands of people. It could have made a huge impact back then, but it was just...
Well, it can make a huge impact now. I mean, yeah. I think about, look, I just think about all of the times when I've gone in to see a doctor, right? I mean, people who watch the show, my hips, my knees, my shoulder. I mean, I'm like a medical nightmare. And yet every time I go in, the first thing they do is say, all right, we're prescribing you this. And, and then it's okay. And then we'll figure out how to make it go away, i.e. physical therapy or some kind of surgery. But it's like the default is, here's the drug we're going to give you to mask the pain.
Exactly.
So walk me through, you say you discovered, then walk us through the evolution. You find this, yes. And then what?
So once I found it and I saw the initial reports that I read, which was done from Scripps Research down in Jupiter, Florida, they compared, and this isn't marketing, this is their medical research. They compared it to morphine without side effects or without risk of addiction. That was in 2011. So then I followed the evolution of science as it was happening with canoladine. And what later on was figured out is that canoladine attaches itself to a pain receptor that we now know as a scavenger receptor. So we used to think there was 4 receptors in the brain. Those are the 4 that things like OxyContin, morphine, these different painkillers will attach to and give you relief. Well, what they figured out was you have a 5th one that's robbing your body of your natural endorphins. Now, your endorphin flow is essentially your internal painkiller. In fact, the name itself, endorphin, means internal morphine. That's how they came up with the name. It's the way our body naturally kills pain. The problem is, as we age, our endorphin flow gets more and more robbed by the scavenger receptor. So if we're 8 years old and we fall off a bike, we can get right back up and we're fine the next day. At 18, at 28, 38, 48, and keep going as you get older, it gets worse and worse, where if you have an injury at 50, you might never recover from it, right? You're always in.
Is that a hint, Clint? Is that a hint? I need to be more careful.
No hints. Just saying. That's the reality for most Americans. I mean, I'm 42 years old. I face the same thing. And so what this does is allows that endorphin flow to get back to normal. So within 7 days, canoladine totally covers the scavenger receptor. And all of a sudden, your 4 main receptors are now receiving endorphins like they're supposed to. So it's the first ever pain relief supplement, essentially something you take on a daily basis to enhance your endorphin flow. And when you do that, it's like dialing down, dialing down a stove, dialing down your pain dial. All of a sudden, it goes from something that's limiting you every day to you feel better because your body's dealing with it and you're not inebriated.
Do doctors know about this? Like, why wouldn't my doctor, it's funny. I know people who go through surgery. And these days, right, you probably know some of them too. You go through a surgery and they're very cognizant of how long they keep you on like an oxycodone or something because
yes.
Okay, why wouldn't they just say now, hey, we know about canolidine? Where are doctors in this? Are they saying, hey, we now know about this product that Clint has brought forward?
So luckily the ones that now do know about it are gathering around it and starting to tell their patients about it. But again, Sean, remember, they have to be very careful because their licensing is all based around pharmaceuticals. So they're truly afraid of losing their licensing by telling people natural solutions that exist because they're kind of inside the system of pharmaceuticals.
Well, if you enjoyed this content, make sure to like this video, subscribe, and click the notification bell to get more.